Okay. Good evening, everyone. Thank you for joining us. We are going to be starting our panelist hour. Dr. Kizzy is what she calls herself, and Dr. Kizzy is talking with our Empower girls as we speak. Her and Dr. Hutchings will be coming in right now. We'll begin the Q&A question with her. We have two students on. I see Leslie Eisen, and on my computer I can't see the other student. We have, my audio is breaking up. Wow. Okay, and there's Kendra. I will let the superintendent know that the audio is breaking up and we'll get him some headphones. So thank you so much for coming. And without further ado, I'm going to bring our special guest into the Zoom.
Hello, welcome Dr. Kizzy. I have a question for you. Our ACPS 2025 strategic plan has equality of forefront. Having women, especially women of color, as scientists is also an issue of equality. How did you break the barrier?
Well, first of all, thank you a lot for having me. I am very blessed to be in the presence of so many great students today and the community. And also it is a very unique experience to have a school that is so invested to outreach. And I have kind of spent the last year doing that. And so I'm very happy that this kind of thing is happening. And, you know, right. So I am a woman, and the issue of equality or equity rather in the sciences is one that is very ingrained, especially the higher you move up in the sciences. And so for me, the truth is I actually don't feel like I've broken the barrier just yet, because I am only now getting to the point where I am going to have my own independent laboratory as of next Monday. But getting to that point took a lot of advocacy from people at various different stages, but also mentorship. And also it took for me and my mentors to say, okay, for my mentors specifically to say that I could be at the table with them. And so having people to pull you in is very helpful.
This question is for Dr. Kizzy. The Moderna vaccine is being used all over the country to help slow and prevent the spread of COVID-19. How did you gain the confidence to be a world changer during such a devastating time in America?
I'm religious. And so I would say that it is something that I didn't necessarily see as myself, but saw as what was God's purpose for me. And so my confidence comes from a place that I can't even begin to describe, I think. Also, it was important that it's important to note that in the beginning of all of this, who else would have done it if we didn't step to the plate? And so when we were designing the vaccine in January of 2020, we were the only people in the world thinking about it in that way. And so it really became moment meets preparation, and that's where the confidence comes from.
Okay, this next question is for Dr. Hutchings. What are our plans and progress in ACPS to get everyone vaccinated?
One thing that we're doing is continuing just to advocate for all of our students who are eligible. These are students who are 12 and older to get vaccinated, and we're having family vaccination opportunities where the entire family and students who are 12 and older can be vaccinated right here in the city of Alexandria. This is a partnership that we have with the Alexandria Health Department, and then also just making sure we educate our families on this vaccination. We have a predominantly Black and brown community in Alexandria City Public Schools. And fortunately, I am African American who was vaccinated, and I advocated for, I had to even talk to my own family members. My mom was like, she wasn't gonna get vaccinated. I said, well, Mom, you're not gonna be able to see me if you don't. So you got to get vaccinated because I want to see you. And we really, I'm just speaking in my own household, had to break some of those barriers and just some of the trust that many people of color have in regards to our government and some of the vaccinations that have been out there. But we're educating our community. We're making sure that they are informed about the health and safety mitigations that we have in place. And also we're making sure that we keep everybody informed of any new information we've received from the CDC or the Virginia Health Department.
This question is again for Dr. Kizzy. At what point in your life did you realize you wanted to become a scientist? And if you weren't a scientist, what would you be?
Okay, so I did my first internship when I was 16 years old. And so I realized that I wanted to be a scientist when I was 16 years old. And I think at that moment, because I realized so early, I was so determined to be a scientist that it's very hard for me to say what I would be otherwise. I still cannot answer that question no matter how many times that people ask me.
This next question is for Dr. Gaddy. How was Dr. Kizzy's work to help the city to get handle on the virus?
So Dr. Kizzy's work has been amazing at helping the city to get a handle on the virus, not only this city, but across the country. And I would say that, you know, sometimes when people look at what a vaccine does, they think of it a lot in numbers. So we see that a certain number of people have gotten vaccinated and the number of cases is going down. And we hear a lot of data and statistics. But I have to tell you, from the health department's point of view, this is not only about numbers, it's also about a lot of emotions and mental health and well-being. So, you know, in the beginning of the pandemic, really from last March, when we first really started seeing the virus in the United States, all the way until the end of December of last year, our health department nurses would talk to people who got sick, and they would try to tell them what they needed to do to keep the virus from spreading to other people, and how to isolate themselves, and how to keep their family separate from them so that they didn't spread their virus maybe to their family or their friends. And as these nurses were talking to families, it was very sad because there were so many people who got really sick, who died, who lost their wife or their husband or their son or their daughter. And it was so frustrating to not have a really good way to prevent this virus from spreading and really hurting people. And then towards the end of December, along came the Moderna vaccine. And it was this wonderful piece of hope for everybody. And it was a piece of hope for the health department, the nurses who really felt like in some ways a little bit powerless to really try to make people better and prevent the spread of coronavirus. And now they were able to give this vaccine to people and keep them from getting sick. And some of the first people we started giving the vaccine to were healthcare workers. And that was really important to help contain the spread, because if the healthcare workers were getting sick, then they couldn't help take care of people with the coronavirus and help their families. And so first we vaccinated the healthcare workers, and then we started being able to vaccinate people who were older. and meaning people who were, 80 years old, 75 years old, because these are the people who, when they catch the virus, they have a very high chance of getting extremely sick, needing to go to the hospital, and even dying. And so as we started giving the vaccine to those people, we saw both here and across the country that the number of deaths in people who were older like that, and the amount of people getting sick in nursing homes just dramatically dropped. It went way down. And so then we were able to start vaccinating people who were younger and younger. And now we're able to vaccinate people down to the age of 12 years old. And so it's really exciting to see that as we've been able to vaccinate more people, the number of people getting sick is going down. And that all comes back to the research and hard work that went into making that vaccine possible. And so I would say the next step in being able to contain the virus actually has a lot to do in some ways with you all. And I'm really excited that you are taking the time and are interested to ask these questions and learn about the science, because I hope you will spread what you are learning to your friends and your family, because now we have this amazing tool, this vaccine, that will allow people to stay well. And we want people to know more and more about it so that they decide to get themselves vaccinated as well. So I hope that answers your question.
This next question is for Ms. McSorley-Gerard. How and why are immunizations important for school-age students and the school division as a whole?
It's always better to prevent a disease rather than treat it. Diseases that used to be common in this country and around the world, to include polio and diphtheria and tetanus and hepatitis, are now able to mostly be prevented with vaccines. And as it turns out, most of you on this call have received those vaccines to start school and keep yourselves safe. Thanks to vaccines, one of the most terrible diseases in history, called smallpox, is now only found in a laboratory. It's not found elsewhere in the world. So with vaccines, we can protect ourselves and others from getting diseases that used to once take people's lives. So this COVID-19 vaccine that the scientists have worked so hard day and night to make to keep us safe will hopefully afford us and our friends and our parents and our teachers the same protection.
Okay, this question is for Dr. Kizzy. Once you started on your career path, what steps do you take to reach your goal and ensure success for yourself?
Oh, wow. This is a great question. Oh, man. So the first thing that I did was once I realized I wanted to be a scientist in high school, I went to go to college and majored in biology. And when I was in college, every single year as a biology major, I would do research in a lab every single summer. So I went to New York one summer. I did research for the government in the US one summer. And then after I graduated, I went to get a PhD back in North Carolina at the University of North Carolina. And even during my PhD, I also did research in outside of my school. I went to Sri Lanka, which is a country in Southeast Asia, and I did research there. And then I graduated from my PhD. And then once I finished my PhD, I came to the government, and that's where I work right now.
This last question is for Dr. Kizzy. Before the COVID-19 pandemic began, what types of science projects were you working on, and what are you currently working on?
So before the pandemic began, I was actually working on science projects that were related to coronavirus in the same way that I work on projects right now for this coronavirus. And so we were doing vaccine development for the other coronaviruses prior to this particular pandemic. And what I'm working on right now is every single time so right now, as of, so the vaccine that we have, the Moderna vaccine, people are getting that vaccine every single day. And some of those people are, we're very lucky to have those people in various different clinical trials. And so they give their samples to us, and we are allowed to ask really cool questions based on their samples. And so we ask about the types of immune responses. So how does their immune system respond to the vaccine? And so the team does experiments to understand that. And we also, looking forward to different types of vaccines, are looking inside of animals like monkeys to understand different other types of vaccines as well.
Thank you, Dr. Kizzy. Are there other members of our panel who have questions for Dr. Kizzy or Dr. Gaddy or Dr. Hutchings?
I know that we were going to ask for the board chair to ask a question, as well as for our school board member, Ms. Green. So Ms. Alderton, Ms. Green, and then Dr. Crawford has a question. So let's start with the board chair, Ms. Megan Alderton.
Well, hello, Dr. Kizzy. It's really nice to meet you, and thank you so much for coming today and speaking to our wonderful students. One of our students, mentioned to you in the first question that, our strategic plan is all about racial equity. We are on this journey as a school division to make sure that, every student has an opportunity for success. And we've been pretty clear in our work that a lot of that means that we are removing barriers for students. So that they have, access to a high quality education. My question for you would be, as a Black woman in America, what advice do you have for our young ladies in terms of just staying the course, overcoming barriers, overcoming challenges? What would you tell young girls who, whatever their dream is, what do they need to do? What do they need to stay focused on?
I guess one of my personal dreams is that they won't have to overcome barriers and challenges. I think that we've maybe as a society become a little bit too comfortable with resilience being a good thing. I would just hope that one day no one would have to be resilient because everyone is treated fairly, and there are no hurdles for which one would have to jump over to just be exactly who they are, which is, I think that like it's any little girl's dream, right? You just want to be who you want to be. For me, when I was 16, I just wanted to be a scientist, and to get to the point where you realize that there are barriers that could potentially keep you from that is a little bit devastating, and also a little bit, I would say it pushes back on your dreams just a little bit. And so it is without a doubt that unfortunately what is my dream for people, not just girls, but everybody, probably won't be realized, especially before these fifth graders get to the point, at my age. And so because of that, one of the most important things is just that piece that I said is we're just remembering who you are. And also, for me, I think it has become imperative that I remember not just who I am, but from where I came and also from where I conquered. because as much as anyone who currently has a seat at the table would like to think that my experience and what is my place at the table is unwarranted, it is, you know, I don't necessarily even know if having a vaccine is the most advanced of what I have had to conquer in my lifetime. And for a lot of people, if they reach back into what they have done, they will start to see those things about themselves. Like, I'm already a scientist, or, you know, I answer math questions, or I can solve a math problem in my head. I'm already a mathematician, and really kind of basking in that really helps you to see past what the barriers are that you will come in contact with. And then aside from that is there will, as you creep up the ladder, so it's a very slow climb up the ladder, you will have a lot of people who will be at the prong of the ladder that is ahead of you, who will be reaching back very willfully and open-armed to pull you up, and to be accepting of that, I think, is very important. And to notice that, because it won't come very verbatim. It won't be like, I am dean of XYZ school and I want to pull you up here with me. It will come subtly, but realizing who your mentors and your advocates are is very helpful in the slow climb.
Am I next, Dr. Hutchins?
Yes, Ms. Green, I'm
Okay.
sorry. You're
Thank
next.
you. No problem. Thank you, Dr. Kizzie, for being with us today. It's truly inspiring to be in the presence of a superhero, as I told you a little bit earlier. So thank you for all that you did basically to help to save the world. My question is about the Moderna company. I read in an article that at first they were very hesitant to jump into creating, potentially trying to create the virus, and that you were instrumental in convincing them that we needed to do this. And had we not been able to do this, where would we be now? But that's also good skills for our girls to know that, you may want to do something, but you have to convince others, to help you to be able to achieve that goal. So how were you able to do that?
So I will say that I have not read that article, but I think that, so we collaborated with Moderna for a very long time. I guess 5 years even. And so we had a very trusting relationship. What might seem like hesitancy, I'm not sure who wrote the article or how it was written, but what might seem like hesitancy is business, right? It's a business decision to go into vaccine development, which is a multi-billion-dollar process, especially for a company like Moderna, where in the beginning of the pandemic, they were not in the billions of valuation as far as their finances are concerned now. Well, but so, I'm not so sure it's about convincing. I wouldn't necessarily use that word, but as more so as reminding people of why you have the collaboration to begin, and what were the goals and the aims of the collaboration to begin. And one of those aims was to prove that we could make a vaccine and that it could be good. And if not in this moment, when will we ever do that? And so I think that that's more so how that goes. I can't say that even my voice was that powerful in that. I sit amongst giants who probably have a little bit more power when it comes to asking a company to drop billions of dollars on a product, but my data. And so that's one of the things that I like to say is, like, people will say, oh, like vaccine development and like all of these things. One of the things is that everything in my lab notebook remains true. And so stepping back and realizing that all the things that you have built up into the moment, I use data as the example here because I'm a scientist, but the girls on this call, in their case, that will be different. But whatever it is that reminds you that you can be confident in your work, holding true to that and reminding people of it is important.
I think I have the next question. First, I just want to say thank you for this wonderful opportunity to meet you and to hear from this awesome panel. I am the proud daughter of a woman who got her biology and chemistry degree. So I will say, while that was sort of our home, my sister ended up going to school for chemical engineering. And when we asked her why, it wasn't my mom's influence, my mother was dismayed to learn. She said her calculus teacher, her math teacher, was the one talking about how there aren't enough women in math and science, even at that time. So I would just say to our ladies on this call, like to our students, don't ever forget, as you've been hearing, the message of the unbelievable power and intelligence you have that the world needs, and don't let anybody convince you otherwise. And the other thing I would say to our amazing staff on the call, to always remember the impact of your vision and your expectation for your students, and where your expectation and your words can lead, or opening the doors. Like even going back all that time ago to my sister's class, where when she told us that story, she said, oh, I bet that teacher doesn't even know that that's what changed the deal for me. That's what made me decide to study chemical engineering. So, you know, I will say girl power all the way. And you guys are amazing. I can't stop looking at Leslie, at your crown in the background. Dr. Hutchings, I think we're going to need some of those for your senior staff. But Dr. Kizzy, the question I have for you is, we have been so lucky in ACPS to have had a working relationship with our health department pre-COVID. So as just crazy as the last year was, we had such strong collaboration that we didn't face a lot of barriers that I think people did with schools and health departments, because we knew each other, we had communication systems. And I was lucky enough to be at a lot of the pods, but my question for you is less scientific, but have you had a chance to go to vaccination clinics and see the work in action, and to talk to people who are there? Because that was just such an inspiring time, especially early on, where people were just shedding tears of joy that they were having the opportunity to have this life-saving measure. So I didn't know if you've had the chance to go out and take off your white coat and see your work in action.
Yeah, I have. I've been to several vaccine clinics, actually. Yes, I have. And I mean, I cried tears of joy, so I can only imagine what anyone else would do. But yeah, it's the amount of gratitude that is being expressed by people who are getting vaccinated. I will never get tired of that. It is a very fulfilling moment for me.
Dr. Kizzy, I just want to once again thank you for taking this time out, and we are honored, one, to have you here. I think that you are an inspiration. I always talk about Black excellence, and I just have to say, right now, I'm in the presence of Black excellence. And when we talk about letting our communities that are the most marginalized to know that we can have people like you who can actually make a difference for our country, it just says a lot about the future. You know, I know that we're going to have a new day. I know that our young people in this next generation, I think about, you know, my wife and I's two children, that they're able to see Black and brown leaders, whether it's on television or in articles that they read. Um, Even today, this was the highlight of my conversation this morning. I'm coming to see Dr. Kizzy, everybody. You know, like I'm going to see her today. And I told my whole family about that, right? And it was a big deal. They're like, wow, I mean, you have pretty much changed this world. And you know, I don't know if you know this, but you are truly an inspiration to so many people that you don't even know. And I just want to thank you personally. I also want to thank you on behalf of Alexandria City Public Schools, because one thing that we talk about is being unapologetic about dismantling systemic racism within our school division. We are unapologetic about it. I am proud to be an African American superintendent. I'm proud to be African American in general. Everybody sometimes don't like that. They may feel uncomfortable about it. But now that I know that you were sitting on here with me and our board members, and you're speaking some of the same language that we say consistently, you know, across all the meetings that we have had, this is validation that what we are doing is worth it. and that we are not the only ones in this country fighting for the next generation. So I just say thank you on behalf of Alexandria City Public Schools. Miss Priyan Johnson, who is our principal here, as you all know, she is a rock star. She is retiring in the next couple of weeks as the principal of Polk. And I just want to tell her, this is the perfect way to exit your job, to have Dr. Kizzy here as you are stepping into whatever the next chapter of your life is going to be is just simply amazing. And congrats to Miss Carla Carter, who is going to be our new principal here at Polk, and she's going to do phenomenal. She has some huge shoes to fill, but I know she knows how to fill them, and she will. But it's just such an inspiration. And then finally, I just want to say this. You see right now, I'm always in the presence of powerful women. So, and I don't have a choice, especially with the board. It's powerful women, powerful women. I go home, I got powerful women, my wife and daughter, and my mom, and all my aunts, and I got 10 of them, 11 of them, excuse me, 11 aunts. And it is always great to see women have a seat at the table. And what we have to do as men in this country is we need to step aside and allow for women to lead and to support them as they take on this journey. And you're living proof to show that women do run the world and they can make a difference. And, you know, as Ms. Green said earlier, you are a real life superhero for many, including for me. So I just appreciate that. And I know we're going to conclude here at this time. I don't know if there are any final comments that we have from our students, but I think this would be a great opportunity for you to close us out.
Yeah, you know, actually, I try to be one that doesn't leave questions unanswered, especially if I have time. So there's one that I think is important that is in the Q&A. And it is, as we reach herd immunity and our at-risk populations are vaccinated, why do children need to be vaccinated when there is no long-term safety data on how can it affect their fertility and their hearts? And so it's a very multi-pronged question, but many pieces of this question are things that we get a lot of the times. So I'm going to try to break it down. I think that one of the things that is a misconception is that children are not an at-risk population, especially as now what we're seeing is the slope in deaths in children going like this, because we've moved all of what are classically considered the at-risk people, the elderly, and more, you know, middle-aged adults out of the way with vaccination. Now the vulnerable populations, you can see just the deaths in children increasing. Not only that, but as different virus variants circulate, they continue to make themselves better in the vulnerable populations. And so we're seeing that, you know, variants from like the United Kingdom and other places are better at making more disease in children. And so children actually are considered at risk. Anyone who could come in contact with the virus is considered at risk. And then the point about herd immunity is one that is an unfortunate thing that we have really placed so much onus on herd immunity in this moment. I think in the beginning, the purpose was genuine in that you wanted people to realize that you do need to reach this critical threshold where a large proportion of the population is protected. And that helps us to slow transmission, which we're starting to see. But that is very community specific. It's place specific. So if I were in this office where I'm sitting right now, and you know, with 10 people, and I'm the only person that's vaccinated, but one person has the virus, that means that the other 9 people could get sick, even if the United States is at herd immunity. And that's what the schools would look like next semester. That's what your community playgrounds could look like. That's what ballet recitals could look like. And that's what band practice could look like. That is what will be the situation for children if they opt not to get, if them and their parents opt not to get them vaccinated, is that they become severely vulnerable in a cloud of what is considered to be herd immunity. As far as long-term safety data, I want to remind everyone that with this particular vaccine, these particular vaccines, the first person was vaccinated last March. So we are over a year into safety data. the FDA monitors those people that were vaccinated last March and every single person that was vaccinated since then in a very continuous basis. And messenger RNA is not news to me as a scientist because we have been developing messenger RNA for over 15 years. And it has also been inside of children for over 7 years, I think, at this point, with other investigational modalities, whether it be cancer therapeutics or otherwise. And so we have tons of long-term safety data on these types of technologies, and also tons of long-term safety data for vaccines in general. And in the same way that you saw that Johnson & Johnson's trial rollout was halted for 6 blood clots, imagine what would happen if there was any indication of any safety issue with these vaccines. It is just not plausible at this point. And in general, 95% of indications of safety around vaccines happen within the first 2 months. That's actually why the FDA is smart enough to say you can't even apply for a vaccine to be approved unless you have 2 months of data, which is why now the vaccines are being rolled out in a very strategic way with younger populations as those months of data start to continue to accumulate. As far as fertility, it's been proven time and time again that this vaccine cannot affect fertility. Actually, there is actually almost daily data that comes out, the most recent of which has come out of people who were on fertility treatment, showing that the vaccine had no indication towards a negative effect on their treatment. There's also people from the vaccine trials that got pregnant. There are hundreds of thousands of women who've been vaccinated that have been successful in getting pregnant. It does not have any effect on fertility. Actually, scientifically, it doesn't even make sense that it would affect fertility. Messenger RNA is not news to your cells just because it's something that seems like it's like foreign. Actually, your cells use messenger RNA on a day in and day out basis to make many different types of proteins, whether it be, insulin or whatever inside of your body. And so your cells are not doing anything that they would not normally do, except we're telling them for only 24 hours to make a specific different type of protein so that you can make a really good immune response to COVID. And that's it. 24 hours, it reads that message. The message goes away because it chomps at that message, and there's no RNA left inside of a person's body. There's no reason why there might be an effect on fertility, and there's no targeting towards fertility organs either. So the reason why you get a vaccine in your muscle is because the cells right here do the dirty work. And your hearts, there have been cases, oh gosh, I forgot how to explain it, myoclonitis, which is a very temporary heart condition that have been seen in adolescents to a 0.00002% of the people in that age group that have been vaccinated, which is a very low risk assessment as compared to the heart problems that have seen in adolescents from COVID. And so as you make those types of assessments, thinking about, that level of percentage versus what could happen if your child were to get an actual virus that replicates in their lungs next door to their heart, is just the type of risk assessment that each individual has to make. But I think in all, the reason why there's a vaccine that is authorized for use in this age group is because across the board, the risk assessment pans out that it is much safer to be vaccinated rather to get COVID. And no one wants to see large amounts of children being ill from a very preventable disease. And that was a very long answer, but again, it basically answered every single thing that anyone could ever ask. And so I felt like it was necessary. And I will close out by saying it has been a tremendous honor to be with you all and to answer your questions and to meet with your students. And I'm moving to Boston, so I won't be able to come down here anymore, but I'm very happy to have been, you are one of the few schools that were actually able to get on my calendar. So I'm happy to be a staple in your community. And I wish the program and I wish the students and I wish the teachers and I wish everybody the best of luck. And as best you can, if there are still lingering questions about the vaccine, particularly as it pertains to your child when the vaccine gets to their age group, please, please, please consider the resources that are vaccines.gov. I will try as much as I can to keep my Instagram and my Twitter page updated with the most up-to-date information. And I'm very transparent and I speak the truth. So hopefully that means something when it comes to the level of trust that you have in the data that comes out from this vaccine and any other ones, really.
Okay, our student is close us out.
The empowered girls at JKP cannot thank you enough for coming to speak with us today. Thank you to the panel and the community for joining.
Bye.
Bye.
Bye.